Millions of doses have gone out, but when it comes to getting the shot, will Americans opt in? Even as past presidents volunteer to lift a sleeve, there's real reluctance from ordinary Americans when it comes to getting the vaccine.
I'm scared for it. I just don't know enough about it.
I mean, if it'll help everything open up faster, why not get it done?
I'll be real hesitant to get in line right now.
A new Associated Press poll found less than half of all Americans say they'll get in line for the COVID-19 vaccine. And even healthcare workers are skeptical, with one national survey showing more than a third of nurses skipping the vaccine, another third unsure. Nearly 80% of those nurses said they were concerned because they hadn't received enough information.
I think it's only natural to want to know those details.
Claire Hannon with the Association of Immunization Managers says the public needs to see behind the curtain to understand how the FDA approved the vaccine. Same for medical workers, who Hannon believes should see the data so they can lead by example.
It's going to be really important to put that information in front of healthcare workers in the way that they can read it, they can understand it, and assure them, yes, this vaccine has jumped through all of these hoops.
But in today's world, the government is not the only source of information about the vaccine. Spotlight on America discovered social media is playing a powerful role in decision making.
It's becoming even more influential during COVID.
Neil Johnson is a George Washington University professor whose team has been researching vaccine views among millions of people on Facebook, looking at the connections between communities of people and how they spread information that influences decisions, especially about the vaccine.
This entire ecology suggests that there will be significant reticence to being first in line for a vaccine, and we don't really see that changing or going away.
Johnson's research into that ecology shows that when undecided people turn to Facebook for vaccine information, they're flooded with anti-vaccine views, which he says often contain misinformation.
All of these issues, which were never discussed before by these other mainstream communities, are now being discussed.
What can be done to basically sway the tide?
Going after the hardcore opponents is not the way to go. It's the majority, is the huge kind of mainstream of these quote unquote normal communities. They're the ones that need to be engaged and messaged.
So when it comes to vaccines, the message, Johnson says, has to address the roots of misinformation people are hearing about. If you want to convince skeptics to join the battle against a deadly pandemic, one shot at a time. I'm Josie Sturman for Spotlight on America.